It's that time of year again, election season. Like all elections, the stakes are high, and the responsibility of the constituents has never been greater. It is essential for constituents to know that a portion of your rights are infringed upon at the local level. During these times, we are facing some tough choices as a state and a nation. These choices can ultimately lead us to asking ourselves, what am I voting for? WhatAmIVotingFor.com is a voting guide and resource for Oklahomans across the state. In essence, it will provide a vital breakdown of state questions and judges so that constituents can make an educated vote in the state of Oklahoma. To learn more, visit WhatAmIVotingFor.com. We sat down with Adam Maxey from Americans for Prosperity to discuss State Question 802.
So explain to me, what is State Question 802?
State Question 802 is a constitutional amendment that was gathered through initiative petitions and citizen signatures to put on the ballot to enshrine into our Constitution Oklahoma's acceptance of federal dollars and expansion of the Medicaid program to those up to a certain point above the federal poverty level to provide government insurance to.
Okay. And the second question is, should Oklahomans vote yes or no for this state question?
I believe Oklahomans should not vote for this state question. Accepting all of those strings and federal dollars that are dangling out there mean a lot of hard decisions, cuts, tax increases, and unforeseen consequences of enshrining something of this magnitude in our Constitution. So I would urge everyone to vote no on June 30th.
Okay. And the next question is, there's a perception that this is our money and we're just bringing it back from Washington. And, you know, a lot of people really like that idea, you know, bring it back from Washington. I mean, what's wrong with that idea?
Well, there's several things wrong with that idea, Kevin. I think first off, the first thing that comes to mind is I believe Oklahoma's already 12th, I believe, in acceptance of federal dollars already.
Okay.
We are 12th. If we were to accept this extra almost $1 billion from the federal government, we'd be a top 10 state in a category we don't want to be in.
Oh, most definitely.
Which is federal dependency. And every dollar we take from Washington is more influence Washington has on our state budget. So if you will hear lawmakers talk about the apportionment process in Oklahoma and how little of the state budget they actually get to apportion themselves and how much is already got strings attached to it is dedicated to a certain cause, this can raise that even further to where our state legislators have very little say over the entirety of our state budget.
Okay.
And every dollar we take from Washington is a dollar of influence people in Washington have on our state. You know, it's Nancy Pelosi or, you know, should Joe Biden win in November or Chuck Schumer, whoever it is, you know, that's politics. Yeah. Your friends aren't always going to be in charge. And, you know, that's influence Washington has on Oklahoma, and that's not good for Oklahomans.
Yeah. And I also think it's a false narrative because really when you say that, you're kind of talking that conservative language a little bit, and you're trying to make it seem like people are getting to keep their money. Right. These are two separate things. Keeping money out of Washington, bringing money back from Washington is a lot different from a citizen getting to keep their money. So if you send something to Washington in order to, you know, sign some kind of deal to get that money back, there's no free lunches in any of that.
No,
you know, like
you're
people are going to
right.
people are going to be in control of that. You know, people are going to be in control of the purse strings. We don't have the House right now. God forbid we lose the White House. If we lose the White House and the Senate, you're going to have Chuck Schumer, Nancy Pelosi, and Joe Biden possibly, you know, running healthcare in the state of Oklahoma, and that just can't be allowed to happen.
Well, let's be real about that for a second. It's money that the Treasury is just printing. It's going on to a $25 trillion federal deficit that our children and grandchildren are going to have to reconcile someday. We've seen what's happened on a global scale right now, and people buying American debt, and all of those things are very real. The deficit is a real thing, and we're only adding to it. Quite frankly, it's not anybody's tax dollars; they're just dollars the feds are printing.
So it's not like we're talking about tax dollars that are leaving your pocket going to Washington. You're actually talking about they're going to print more money and send it our way. When really, like I said before, this is no free lunch. They're not just giving us something because they're nice out of the kindness of their heart. There's an agenda behind this, most definitely.
Absolutely.
Okay, so the next question is, what makes this approach with the state question, what makes this approach different than our lawmakers writing a bill?
Mm-hmm. Yeah. So, I mean, there have been several attempts in the legislature in the last 10 years to do this, all which have failed for a reason.
And that should tell you.
They represent their constituents, the Oklahomans, the hardworking Oklahomans who don't want this. But this is different than writing a law because it's permanent. It's in our Constitution. If we wanted to make a change to this healthcare program, should it be enshrined, we've got to go back to the ballot and re-amend the Constitution. Yeah. It's no easy task. And we see things pop up over and over and over in state government where the Constitution in Oklahoma is a limiting factor. It's an extremely long, cumbersome document that when it was proposed as Oklahoma was a state, it was said it was more like bylaws than a governing document for a state. And so it's so problematic to say that we're going to take this federal Medicaid program. There's a lot of question around it at the time right now too. You look at the left wants Medicare for all. The right has said for years, we don't like this, but this is the program we want to choose to try and live with forever in Oklahoma. It stifles innovation. It stifles opportunity. It's the wrong thing to do to try and continue to shove things into the Constitution.
And on another note, it really doesn't make sense that you would redo your Constitution every time you try to pass a law when things should just be laws. And if the lawmakers already said they didn't want to do this and they're representing they're up for a vote and they're still in office, so they'll pay the price politically. It doesn't make sense to change the Constitution every time you want to pass something like this. It really doesn't. It'd almost be akin to every time you wanted to make any little purchase in your home, you take out a mortgage or something like that. You really wouldn't do something on that magnitude because it's such a big thing that is almost immovable. Once you put it in there, I mean, that just tells you right there why people are so eager to put it in there, because it's going to be almost impossible to take it back out on the back end. But we can move on to the next question. The next question is, how will this affect state budgets going forward in the state of Oklahoma?
So I'm glad you asked that question. Last Sunday in the Tulsa World, I believe, I don't know when this will air. So a piece in the Tulsa World quoted some top members of the state legislature who, quite frankly, said if this passes, we are going to have to make cuts, and they may be deep. Given the economic conditions we're in, our state budget, our revenues are already down. Given the unemployment numbers, Oklahoma's really struggling to find the economy right now. I mean, we're looking at places where cuts to core services, education, transportation, police and firefighter pensions, those things are going to take a hit because of this. If the price tag on this is hefty, and we can't afford it. And you look at how the state, I mean, the state passed the largest tax increase in state history 3 years ago now. And all of that was given education. We wanted to fund education. We want to move that forward. Well, if that's the largest piece of the budget, it's going to compete with the Medicaid piece of the budget, which will expand. And if I was a teacher or a public school parent right now, I'd be against this. I'd be scared that this is going to take some money away from those other priorities in state government core services Oklahomans depend on.
Yeah, it definitely goes back to the same notion that this is not a free lunch. It's being sold as this is some kind of free lunch. It's some kind of giveaway. This is something that is on the table that all we have to do is take it, and there will be hardly any consequences for it. These have dire consequences for the financial status of our state and also regulations and other things like that as it pertains to healthcare going forward.
I want to touch on that for a second. With this in our Constitution, it's enshrined in our Constitution that we follow federal statute as this implement. Almost every state that has expanded Medicaid or the Medicaid program at all has there's a waiver process they go through with the Centers for Medicaid at the federal level to say, we want this piece, we need to tweak this. We're special in our state, right? Every state believes that. We would put this in exactly as it was written in President Obama and Nancy Pelosi.
Oh, wow. I did not know that.
With no special carve-outs, no nothing.
Jeez.
And so you talk about unfunded mandates. It is a backdoor into our Constitution, to our earlier conversation about you change the law in Washington. Our Constitution now requires us to follow this. There may be some extra thing we've got to fund. Or when they decide, right now, our current Medicaid program, the population of those who truly need the health care and the help, the trampoline of the social service net.
Yeah.
State pays about 40% of that. Feds kick in 60. They're promising us 90-10 now. And you've seen other states who took it when the carrot was even bigger and sweeter, as the Affordable Care Act has driven down the cost. And now they're at that 90% match. There's no guarantee that doesn't become 85, 80, or down to 60 where it is now on the current population. And that tied in with the perverse incentives of how the Affordable Care Act was written, that the reimbursement rates are higher for these people in the expansion population, which again leaves the financial incentive to crowd out and push back on waiting lists those that truly need the care, the truly needy, the aged, the disabled, those folks who really need the help are crowded out for this expansion population that's put into our Constitution, where Washington can tell us what to do with them.
Wow. It has been said that this will be a boon for rural hospitals. How do you respond to that?
That's out there. A lot of people have said that over and over again. We want to say this is going to save our rural hospitals. Well, the facts just don't support that. Since 2014, in 11 states that have expanded Obamacare, 17 rural hospitals have closed.
Oh, okay.
I mean, I don't know what's different about rural Arkansas. There are differences, but you look at these places, they're very similar populations, very similar way of life.
Yeah.
And those hospitals are still closing. You look at how rural hospitals have struggled during COVID when we had to suspend elective surgeries as a state. That's what they're doing, is elective surgeries. Medical emergencies are coming downtown. They're going to Tulsa and they're going to Oklahoma City. You drive down the highway and you may pull over for an ambulance that passes 2 or 3 hospitals on its way to Oklahoma City to get somebody there, because that's the purpose it serves, and that's how it's doing that. And I don't see how this can save a hospital that's owned, that the money's going to be taken by the giant hospital corporation anyways that still owns this rural hospital.
Mm-hmm.
That
and their choices aren't based on those kind of economics. Their choices are based on a lot of other factors.
There are a lot of economics and other factors that go into that, to the C-suites in Oklahoma City and Tulsa that already control rural hospitals that are making those decisions. So it's a false narrative to believe that.
And it also points to the idea that you see a lot of times with the left, is that if you just put money into something, then it'll just grow, and that's how economics works. And that's not quite how economics works every single time. It's not always about money. You can't just throw money at something and it makes it better. You can't just throw money into rural areas with this Medicaid money and it's automatically going to make these hospitals in rural areas flourish. That's not how it works. And a lot of the times when you look at some of the things going on with these rural hospitals, you're looking at economics, you're looking at sweetheart deals that go on in Washington that help these big hospital conglomerates and make it impossible for a hospital to be independent and to rely on a local population. I mean, you had to fight tooth and nail. President Trump had to fight tooth and nail just to get them to publish their prices and things like that, and to actually compete for prices and for you to be able to pay when you're there, as opposed to it being some big mystery of how much something's going to cost when you're going in for it. Healthcare is definitely a mess.
Yes, it is. And I think it's an important point you bring up. All of the things, the positive healthcare reforms that can happen at the state level to improve access and things, and some of the things that have happened across the country in Oklahoma during COVID. Telemedicine, allowing nurse practitioners to practice to the full level of their training, all sorts of things we can do to help people see healthcare more efficiently and more affordably, and that's ultimately the goal. Well, nobody wants to take anybody's healthcare. We want people to do it efficiently and affordably, so it's not a big mystery and a big scary thing to go to your primary care doctor and be a healthy society.
All right, Adam. Make your last pitch for people who are still undecided after watching all of this. So what would you say to that person?
I want to urge all Oklahomans to vote no on State Question 802 on June 30th. You're looking at a backdoor into our state constitution, taking a federal program and making it permanent, providing insurance to able-bodied working adults with more strings from Washington, a price tag we can't afford. That's going to lead to cuts to services and tax increases on hardworking Oklahomans. And I think the worst part about it is you enshrine this in the Constitution without any safeguards for waste, fraud, and abuse. Some of those things we've seen, the Attorney General's Medicaid fraud unit is a very active unit in that office where they try to crack down on the bad actors. But when you make the pool bigger, there's bigger targets for that fraud and abuse. And We don't want to see that. We want to see Oklahomans innovate and work hard and find solutions to our own problems without Washington injecting themselves into the Sooner states. So once again, I ask everybody to vote no on June 30th.